it's a great talk, and it's a great pleasure to introduce our speaker today, who is it's James Hughes. He's the president and CEO of the Old Brewery Mission, which is the largest organization serving people experiencing homelessness in Quebec. He's also the editor of Beyond Shelters, a book about the future of homeless sheltering in Canada. And he also mentioned, we were just speaking, particular interest to some of you on the policy side. He was the Deputy Minister of Social Services in New Brunswick for, I believe, 4 years, 5 years.
Exactly.
So he's experienced in policy, he's experienced in the homeless sector, and is McGill grad, was in law school here from 89 and 91. So yeah, that's right, represent. So he's going to give a short presentation, then we'll take questions afterwards. If you have any questions, as usual, put them in the chat box, or even just put your hand up in the chat box and say, I'd like to ask a question, and I'll call on you in order. Okay. So welcome, Mr. Hughes, and take it away.
Great. Thank you, Andrew, and hello, everyone. Delighted to be with you to speak to you about homelessness and COVID. I've got a little presentation to share as well, so I'll share the screen to walk you through what is going on the street, literally. Trying to full screen this. There we go.
That's perfect.
Okay, great.
That's good.
So again, yeah, thanks so much for being here. PDG, by the way, means Président Directeur Général. It's my title in French, and we're a French organization, notwithstanding the fact that we were founded in 1889. We've been around a long time, and we were founded by Mrs. Douglas and Mrs. Finley in the old abandoned Webster Brewery. That's the name. The Old Brewery comes from the fact that these ladies of a Methodist persuasion, filled with the social gospel, believed that to bring both sustenance and God to those in the city who were suffering, they would set up this soup kitchen. It was actually they brought soup every day into the Old Brewery, and gradually the men would come and increase in numbers, and it was all men at the time, and thus was founded this now somewhat ancient organization. And I'll just, if you don't mind, give you just in a few minutes a bit of the Cole's notes on the history of homelessness in Canada, which was essentially invisible up until the early 90s. The type of person who was found in homelessness usually was an older male, usually someone who found himself suffering from alcohol addiction. And the organizations that served them were the shelters, who were charities continuing to provide both God and sustenance throughout that period, and in some cases actually still do. With the view of the organization as a sanctuary. People would come in anonymously and would stay overnight and get a meal, and then would be invited to leave the next day after sleeping and showering, and wished luck. Please come back if you like, but it's, you're on your own today. In the 90s, though, some of you may have read about. You certainly probably weren't there at the time. Some of us on the phone were. There was a period of intense austerity that occurred throughout the country, throughout the continent, where budgets were cut massively. The federal affordable housing program was cut entirely to zero by the Chrétien Martin government. Transfers to the provinces were cut massively. Provinces, in turn, cut their own budgets. Budgets in mental health, welfare was brought down. Local housing programs were brought down, and all of a sudden, homelessness ramped up. It went from really being small homelessness to big homelessness. You think of big oil and big pharmacy, big pharma. We got big homelessness, largely as a self-inflicted wound. No one expected that to happen because there had been no history of it. We're going to give you an example. The Old Brewery in 1993 had 150 beds under management. That was its size actually for many decades. 150 men only, that's all it did. By 2003, we had 450 beds, and we had the largest women's shelter because there was so much need for those humanitarian services. So that's what happened right across the country. The Calgary Drop-In Center, the biggest homeless shelter in the country, went from 250 beds to over 1,000 beds in the same period of time. This is not just a Montreal phenomenon. This is a phenomenon right across the country and the continent. Big homelessness was founded on the back of austerity. So what happened from there? There was this sense that all of the organizations were simply witnesses to misery. We'd just basically grown and grown and grown and just continued to provide this dance of the shelter where we give emergency services and people would leave. It was like a refugee camp, essentially, with no real, none of the kind of services to actually help people out permanently. But then the first revolution actually occurred in homelessness in the early 2000s, where organizations like ours said, enough, we're going to become essentially a social service agency. We are going to be part of the answer. We're going to stop managing and start solving homelessness. And so by that time, and this occurred, many organizations, again, across the country, they started turning into housing organizations. And so because the market can't help profoundly sick and poor people at the same time, the private housing market never could accommodate them, and it still can't today. So the organizations, these big organizations, I mean, we're big nonprofits. Like as nonprofits go, we're big. The Old Brewery Mission today has 300 employees, a union, 7 facilities, many, many millions of dollars of support, and it's really quite sophisticated in what it does. It actually, we're very proud of having more housing units under management than we have emergency services under management now. 660 total, of which a small majority is actually housing. So they're in under, I think that was about 5 minutes, the history of homelessness in Canada, not just for our organization, but many. And then COVID came. And here we're going to get into the COVID period. Now, some of you, if you know your history, you know from, I think it was what, September, Chris, Andrews, September to March, 1939 to 1940, there was no land war in the Second World War. There was just a ramp up, and everyone was kind of shadowboxing, getting ready. It's exactly what happened in our city and again across the country in terms of COVID. We completely changed our methods because of public health needs. We reduced these very large facilities we've had by about half and opened up new facilities because homeless people need to be protected as well. Distancing was required. And so, as I say, we had new facilities that were open. The old Royal Victoria Hospital was open exclusively for this purpose. Arenas were open. The Marché Bon Secours was open so that we could make sure people could have some distance. Protocols, hygiene protocols were imposed as well all across the sector. We are, I call us plexiglass nation now. We have more plexiglass in our facilities than in any others I've ever been in. We're incredibly clean. Masking is obligatory, of course. And, we did all of these things, from that period, March, April, May. And wow, we got almost no COVID cases. Like literally this very large number of people. Just give you a sense, in the city, on any one night, there's about 3,100 homeless people. We think that's probably more since COVID. We could talk about that a little bit too. Say 3,500, 4,000 people any one night living in a state of homelessness, whether absolute on the street, in a shelter, or otherwise. And we were seeing no cases of COVID. I know this actually specifically because we set up the isolation facility. So just in case there was cases, the Old Brewery managed the isolation facilities on a different floor in the Royal Vic, both a red zone and an orange zone. Red zone for those who had contracted COVID, orange zone for those who were waiting for the results of their tests because they had symptoms or were in direct contact. But once again, like for this period, like nothing happened. Like we could count on two hands the number of people that got COVID during this time. So we actually figured this out. We've got this covered, no problem. We're very proud of that. December, COVID went flying right through the sector. It started at a shelter just above Sherbrooke Street, actually quite near McGill. A few people got it there. Who knows from where? You just really don't know the source. And like a fire through a forest, because of the living conditions that homeless people live in, dormitories, cafeterias, TV rooms, it swept right through. And hundreds of homeless people got it. We were overwhelmed at our isolation facilities. We weren't ready for that kind of volume. The Red Cross was invited to open up facilities over in the soccer stadium, which of course had been closed, to increase capacity. It was a remarkable time of intensity, hiring yet more staff, training more staff, trying to find staff. That pénurie de l'emploi is very much present in our sector. It's very, very hard to hire. And we had all this pressure. Facilities had to be closed because we couldn't be staffed, or admissions had to be stopped. New facilities had to be opened because homeless people need to be protected as well. During this period, as I say, it was incredibly tough. The media was very, very intensely covering it. So there was a sense of accountability that we don't see very often in the sector. But something actually quite good happened through this period, this very intense, very hard on administration too, not just the frontline staff, because you never know what's going to happen. It's this sense of lack of control that caused such anxiety. Public health was not testing very much. They started testing intensively. You never know when public health was going to come in. We're testing everybody in your facility today. Okay, let's test. We have some people here at our facilities being tested 18 times in our facilities, some more, just because of the dangers, because of the vulnerability. Hostilities ended when the big organizations, ourselves and several of the others, said, look what's happening. While we are very respectful of public policy prioritizing seniors in long-term care homes and healthcare workers, there's another group of people that are demonstrating an intense vulnerability, and that's homeless people and the staff that serve them. They have to be vaccinated on a priority basis. They have to be vaccinated now. And that was on a Tuesday. And by Friday, public health had announced, you're right, and they became the third priority. And within about 4 weeks, 1,000 homeless people had been vaccinated. It was amazing. It was awesome. And it was all, we couldn't have done that earlier. We couldn't have got that kind of attention in September or October, despite the fact that the vulnerability existed. We didn't have a crisis. We couldn't put them higher up the list because there was others who were actually, you remember the days of the Résidence Errant and so on. That was occurring at the same time as us having absolutely no cases. But when we got them, we got attention. We'll talk about that a little bit more. Oops, we thought we were good, we're not good. The variant came just last week. There's 70 people presently in the homelessness community. We're in lockdown again. Admissions have been stopped again. We're having to expand facilities again. We thought we were good. We're not good. We're not good yet. The variant is like, it's even if you've been vaccinated, you can get it and you can get symptoms, and and we're seeing some of that. We've luckily had very few hospitalizations, but it's been nonetheless, we have had some, notwithstanding the vaccination the first time, and not everyone has been vaccinated. So this is an ongoing issue. We are not out of the woods. We continue to be on tenterhooks because of it. But having said that, there have been some amazing gifts of COVID. The federal government last October, excuse me, announced the rapid rehousing program for homeless people. because COVID had demonstrated how vulnerable they were living in a state of homelessness, and that the vaccination for homelessness was housing. And so they put $1 billion up. The Old Brewery, luckily, we're very pleased to have got one of the Montreal projects. There's 12 Montreal projects that will be funded because of this. And the criteria, I love this. This never happens in government. They said, we want those buildings open in 1 year. 1 year. And so we're really converting hotels, because that's what can be converted very quickly. It's really interesting public policy. We were on the phone with Minister Hussen last 48 hours ago, who was talking about the April 19th budget, which announced the renewal of the program. They're topping it up by another 500 million. So it's actually 1.5 billion of new money. So they're going to do it again. The experience was so good. And because the vulnerability is still so palpable, still so obvious. As I said, the variant is after us right now. The other two gifts of COVID, I think, number one, the organizations have never worked closer together. We've never worked closer with public health, with the health ministry and its officials, and with other organizations, Indigenous serving organizations, other big organizations. We're as I say, we really are not a collection of organizations anymore. We're really a sector working together. And we've also absolutely fundamentally realized how important it is that our facilities be as, if you will, as hygienic as possible. I think we kind of maybe weren't as focused or as aware of the importance of that in the past. Interestingly, where except for those staff members who go down with COVID, we almost have no sick leave right now of any kind, because these facilities are so clean, and so luckily we're able to keep staff on the floor in a way we weren't keeping them on the floor before. So I'm talking like there's been no flu this winter. There was no like regular flu amongst our folks. And so really that's the quick story. I've tried to do it at some speed. Hopefully this has been of some interest to you. Obviously there's lots of interesting policy questions in there that you may be asking yourself, your policy people. And one of the questions I'd ask you to consider is, why have we got the attention we have? Why were homeless people made a priority when in the past they weren't, not just for vaccination, but now for new housing programs? And at the same time, why, and that's the federal government, why is the provincial government in its recent budget not put the kind of investments into homelessness that you might have considered, which we're obviously not happy with? They could have done so much more. They could have reflected the same level of commitment as the federal government, but their housing announcements and homelessness announcements have been very underwhelming. So, well, Chris and Andrew, I'll leave it at that. Delighted to have an exchange on all those things. And because I have my own opinions on those issues, needless to say, but hopefully that was interesting and helpful to you to come into our world a little bit, and I look forward to the exchange.
Ricardo, do you have a question?
I do, if that's okay.
Please do.
So thank you, James. Thank you. That was very, very insightful. I actually have been working in Maxwell on the Capstone project with CMHC on a housing policy brief all year. So this is something that we've been thinking a lot about. And I wanted to go back to the comment that you made about Chrétien. I know that like ever since that cut back on the funding, we've seen Canada become one of the countries in the OECD with the smallest percentage of social housing, for example. I'm wondering, where do you see the path away from that? Is it through nonprofit organizations like this one continue to grow and get loans from the government to build, or are we missing some like state force, some state-owned social housing?
Wow. Okay. Well, that's a big question. It's a great question. I used to work in New Brunswick, as Andrew said, as the deputy of social services in New Brunswick, is also the president of the Housing Corporation. So, needless to say, I had to develop some opinions on this. We actually the public managed for 4,500 units of housing, owned housing. So this is housing for individuals who are profoundly low income. That's what they all had in common. And I would say to you that we have a massive problem on the housing front. It's getting worse. Homelessness is only one of the symptoms, if you will. The tent city, you might have followed this last year when that opened up. That is a symbol of a housing market that is working, not working for everyone. It's unfairness, and we all pay the price for that. I mean, the state pays for 50% of Oldbury Mission's costs. They give us a lot of money every year, and not to mention police costs, ambulance costs, health costs. I mean, homelessness costs a lot of money. It costs a lot of money to do nothing for this gang, right? And that's true of all social services. I would say to you that the model, I mean, the models that we have in place now for, affordable social and public housing, kind of in that order, are probably about right qualitatively, but too much money goes into affordable home ownership, not enough money goes into social and public. I think the only way to protect rents and make them affordable in the long term is that they're owned by government or nonprofit organizations. Right now, the gap, though, is massive. There's 25,000 people on the Montreal waiting list alone, eligible for a rent supplement or a HLM program, that are not getting it. So they're struggling like crazy. That means they're probably paying 50, 60% of their income on rent, whereas generally speaking, in a healthy market, everyone's paying no more than 25%. So that's a high level. You'll probably hear in that a progressive opinion on what housing, how it should be organized and managed. As I say, I think the pyramid is upside down, and we need to invest more where it's needed most. And I'm not sure what your view is on that. Be interested in what you think, Ricardo, and what others think. But it's a great question.
Ricardo, do you want to follow up quickly, or are you okay?
I mean, I would agree wholeheartedly. Like, I think that, especially, I mean, not to take us in a tangent, but it feels like the problem of affordable housing specifically cannot be solved without taking wealth away from the people who own houses right now, which is a huge problem. But the problem of social housing and community housing or federal housing can be solved, right? Like, the space is there, the services can be provided. So I wholeheartedly agree.
Good. Okay. I've got a question from Ian Peach. Ian, do you want to unmute yourself and ask your question?
Yep. Greetings from Fredericton.
Hey.
Hey. So I'm really interested in the federal rapid rehousing program. I don't really know anything about it. I should do my own research, but I figure you're here, I'll ask you. Who has access to that? Is it private, simply just purely private orgs like Old Brewery Mission, or is there an intergovernmental component as well? I ask because Fredericton City Council, I would say, has been running away from the homelessness issue at a fiendish rate. And we find ourselves in a municipal election period right now. The elections are May 10. So I'm really interested in whether municipal governments could, if they wanted, engage the federal government in coming up with a strategy, taking advantage of the rapid rehousing program, and if it therefore is something I should be paying attention to from our candidates.
Are you involved in the election? Are you in a conflict of interest asking that question?
No, I'm not. I am helping out a friend on his campaign in one of the wards.
Are we developing his platform right now? Is that what we're doing?
No, we're not developing his platform, but I am actually. It has become, I think, a really politically salient issue in Fredericton. So I'm genuinely curious what options are out there for us to wrestle this problem to the ground. I personally think it is the most politically salient, most important issue in this municipal campaign, because our city council has massively bailed on the matter.
Wow. I happen to know both mayoral candidates, actually. So I'm just very curious. We could chat offline about that, what
Yeah.
the positions are on that. Okay, so the brief on the rapid rehousing program is that the current second iteration is being worked out. The minister actually asked some interesting questions about it based on our experience in the first iteration, but it has two big components. It's $1 billion, and they put 500 million towards what they call the large city portfolio. 18 of the largest cities, Fredericton wouldn't have made it,
No.
got 500 million. And then the rest of the country, they had access to the national competition. And that was not, they didn't allocate by province. They just said, okay, we got 500 million, apply. And frankly, it was up to nonprofit housing providers. Like we are in the big city piece, but we also applied on the national competition as well. So that's the way it was organized the first time. I'm pretty sure there was some projects. In fact, I think I actually got sent something about one of the hotels up on the hill was they're trying to convert that to housing.
That would be the city motel issue.
Yeah, that's right. City motel.
Up in Region Prospect Street. Yeah, well, City Hall.
Didn't go through it.
Yeah. That one up. Yeah.
Yeah. I think they were over ambitious. They tried to do too much, I think, with that one. But anyway, so that's the way it was structured. The second iteration, I mean, if I'm campaigning in Fredericton for how to do this, I would say, okay, we got to get organized and we got to make sure we get our share. And I'd be very political. I'd be pulling in provincial and federal political officials and the civil service. I mean, the New Brunswick civil service is amazing. They've got fantastic. Like they should be involved in this. Remember, there's a whole operating component that the federal government is expecting the province to pay. That gives them leverage. Right. So with respect to rent supplements or with respect to what we call le soutien communautaire, like home support services, that's normally a provincial responsibility. So look, if you've got that, you're expecting us to pay. Okay, well, we want units. We're ready to like, anyway. So that's, and then municipally, like in Montreal, we actually signed our contract for our $6.6 million project with the city of Montreal. So the federal funds actually flowed through the city of Montreal because they said, we'll guarantee that, certain obligations are respected. We'll be your eyes and ears on the ground. There's no reason that the city of Fredericton couldn't do that as well. It may need the blessing of the provincial government to do that. And, that's not for the faint of heart to go through that exercise, but it's, I think, a really interesting program because it's actually putting housing up of the right kind, the right partners at the right speed.
Yeah.
Usually, like, it takes 4 or 5 years to get a 26, 36 unit housing project up anywhere in the country. They're expecting us to get these things open April 1st, 2022. Right. And like we're telling our supply, that's one of the criteria that we're in our demand for calls for proposals. We're saying, can you convert this? And we're also really limiting the scope of the conversion we're thinking of. Like so anyway, it's going to be really cool. It's the speed of reducing homelessness that we should be moving at, in my view.
Yeah. And I actually think here there might be possibility. The city has been fighting with the provincial government. The provincial government's been trying to get the city to be more active. So there may actually be an opening to do something tripartite with a new city council here in Fredericton. So we shall see. Thank you. Thank you for your analysis and your advice.
Good luck.
Thanks.
Emily, you got a question?
Yeah, I think I have a two-pronged question. Thanks for being here, James. I'm originally from Fredericton, so East Coast is represented.
So you're also in Fredericton?
I'm from Fredericton. I'm in.
Oh, you're from Fredericton.
Yeah, grew up there.
Fantastic.
So I think I have, two questions as I was saying. One is, beyond housing, what other kinds of supports are you providing? You kind of mentioned in your answer to Ian that you're kind of working hand in hand with the province, but I'm curious to learn more about that relationship. And then a kind of a second question is, as you're kind of moving more into this owning real estate model, this is dramatically kind of shifting how people think about the nonprofit sector and the charitable sector. How has that been kind of impacting your kind of funding model, but also status as an organization?
Yeah, great question. I mean, the first one, the Quebec's different. It's tricky, right? We actually, for our rapid rehousing project, have not got confirmation that we'll get rent supplements and the kind of operating costs that will help us cover this. But I mean, we're a pretty big place, and we can kind of suffer that uncertainty and even the costs for a while if we have to. But there's many organizations in that portfolio who can't. So in many ways, we'll ride their coattails. Like, there's no way that the province will not put its hand up to fund these projects eventually. But it's funny, like, Quebec has not been proactive in this. In fact, in many ways, they've slowed things down. But Quebec would do that. Federal government giving money to the cities and bypassing us? No, that's not. No, you give the money to us. And Quebec is even though it's not the big, it's the second big. It's the strongest of the provinces, right? It is prepared to say no. It gets political. It gets political capital, gains, put money in the piggy bank when it says no. Any government, any stripe, it does that. So it's a really interesting, in the housing area, there's a lot of friction. Quebec waited like a year extra on signing the affordable housing agreement last year. It was brutal how long they took, but they squeeze those conditions out, and a lot of the other provinces can benefit from that because they won't get any worse conditions than Quebec did. So I remember sitting at those tables a lot, and because at the FPT tables, the federal provincial tables, federal provincial territorial tables, you sit together in order of your joining confederation. So Ontario, Quebec, New Brunswick, and Nova Scotia, right? Right. Always sit at the head of the table. We came first. And then all the other provinces follow along. So New Brunswick always sits beside Quebec. So it's one of the reasons, I swear to God, why New Brunswick and Quebec officials are so close, because they are so close on all these tables. And anyway, when we're battling it out with CMHC or many of these other federal bodies, like, give Quebec the keys. You go. Love it. The way it works. So, okay, sorry. That was a little bit of a aside. With respect to the second question about these organizations getting big, it's a great question because, I mean, with the growth becomes exposure, accountability of the levels we haven't seen before. I mean, as I said, we've become a pretty big organization overall. But we're not. There's a lot of big nonprofits out there. I mean, I think in many ways we have to get bigger. Our mission, right, is to reduce homelessness. I mean it genuinely when I say we would rather be an organization with 600 housing units or 1,600 housing units and 40 emergency services beds, because we have actually figured out a way to prevent and treat homelessness at speed, but we haven't. We're treating it enough just to barely keep that, like the street count, the homelessness street count in 2015, that one night count that we do. This is the best science in homelessness. It's super hard science, right? They counted something like 3,018 people that one night. Fast forward 3 years later, 2018, they counted like 3,300. So the tendency is up a little bit. And this is why organizations like ours are growing, like in terms of number of housing units. And we're not the only one. Like, we're doing hundreds and hundreds of people every year coming in. In other words, more people are coming in than coming out. You think of homelessness like a bathtub, the drain is blocked, is working, it's functional, but the pressure from the shower head is more intense. The next big revolution in our sector is going to be prevention. And it's a greenfield. We're not doing much of it. This is an area that I'm working on now with the Institute for Health and Social Policy at McGill. We've created something called the Quebec Homelessness Prevention Policy Collaborative to try to start at the beginning to figure out what's the evidence base, what's the policy environment, what's a legal environment, to try to stop the flow of homeless people into our sector. I won't open up a whole thing, but I'd love to have Max Bell involved in this. And by the way, Chris, so would Pearl, who's part of the collaborative. So that's a fair warning, just so you know.
I think to step in quickly, I actually now I want to start a research program on federalism and federal seating arrangements at federal provincial meetings, because I think there's probably like a PhD thesis in there or something that you've like set me off on. There's one of our top students, a young man named Chris Reagan, has a question for you.
Thank you, Andrew. So my question actually follows up on just your final few comments there, Jim, about your bathtub analogy. So my question is really about the cause of homelessness and the nature of it. And I want to draw a comparison between homelessness, maybe, and unemployment. So during normal times in this economy, the Canadian economy, at any time there's 1.2, 1.3 million Canadians unemployed. If you look at the data in January and April and September and December, you'll see 1.3 million people unemployed. But there will be a different 1.3 million people, okay? Because there's a huge amount of flowing into unemployment and flowing out of unemployment, about 400,000 per month, okay? My question is homelessness like that? So when you talk about 3,000 to 4,000 on any given night, even if the number is the same 3 months later and 3 months after that and 3 months after that, are they the same people? In which case we have people that are long-term homeless, or what fraction of the people are kind of coming into homelessness and coming out of homelessness every, I don't know, month or two? And to what extent does this difference, what is the difference? And to what extent does it change the way you think about how to reduce homelessness?
So yeah, it's a fantastic analogy and question. There is big churn in the sector. Actually, I forget the McGill researcher's name now. It's Christopher something from social work. They did a study on exactly that question, and the number is about 80%. So 80% will come in and out. 80% of homeless people will actually not stay in homelessness very long. There is short-term, episodic, and chronic forms of homelessness. And the chronic form of homelessness takes up 80% of the resources and represents about 20% of the clientele. So it's exactly the same as so many of these other systems in place. And in our sector, if someone, and I'm sure this is true in unemployment, like there's this chronic group that is just not moving at all. It's just they're stuck. And as I say, they take an inordinate amount of support. It's not that some of them don't go out, move out, but it's really where we have to pay a lot of attention. A lot of people come into homelessness as well can get themselves out without supports at all. And the diagnostic at the door, like, how much support should we give or not give is a really important one, the allocation of resources. We're not, I got to tell you though, we're not that good at it, to be honest, actually being as deft as we need to be at the door. But I mean, we still, as I say, we still do amazing work. We've gone from, basically being a security organization, which watches people, provides things, to being a case management organization. So we know everybody, like we know that, but the thing about our gang is they are exceptionally sick. They are people who have not been able to be accommodated by health and social service systems. I mean, the shelter network is really the social safety net of the social safety net. It's there to actually, it's somewhat ironic that the nonprofit sector is to some degree catching what the public system's failing to be able to handle in terms of the chronic homeless clients. Because, and so who are they? So by this street count is really interesting, because we asked the question in the street count, what is the one reason that you would say has made you homeless? So this is a bit of a, what's that called? A self-reported cause. So it's worth what it's worth in that regard. The number one reason why people are homeless because of the street count is because of addictions. And number two is job loss, and number three is mental illness. So those are self-reported numbers. So those are just super interesting. So those people will be in the shelters, they'll be in the streets, they'll be in the emergency rooms, they'll be in the temporary shelters that are set up. And it's fascinating what you glean from that street count sondage. It's super interesting. But one way or the other, I would say, as I say, like we need to figure out how to mandate the public institutions who are in fact the ones with the public resources, massive public resources to deal with this clientele, to be themselves working much harder to assess for homelessness and divert to housing with supports so they'd never need us in the first place. I'll stop there.
I like the idea, by the way, of Max Bell doing something. I think there's a policy lab here, folks.
Love it.
That's super interesting. Does anyone have a question? Because I've got one, but I'll defer to anyone who wants to put up their hand. I'm gonna ask you a quick question, James. How much? So when the pandemic struck, I remember a year ago, there were all these early reports about areas that were seen as potential hot zones or especially at risk. And homeless shelters were identified. And I remember seeing an article very early on in the New York Times, might have been like March or April of last year, saying that they weren't seeing the numbers that they expected they were going to see, that it just didn't seem to be striking those populations away. And it was part of that whole early, what are the drivers of infection, right? Nobody really knew. And so I was struck by the data you showed about that sort of early phony war, right? That didn't really hit until late. How much did you guys? How much information sharing or best practices or data sharing was there going on in your industry? To put it, and I mean across Canada, but also maybe internationally. Do you talk to people who run homeless shelters in New York City or Chicago or Toronto or anywhere like that, like and talk about what you're up to, what you're seeing, and so on? Was there any kind of quick reaction information sharing?
Well, no, not as good as there should have been. We have something in Canada called the Canada Shelter Transformation Network. So it's a network supported by the Canadian Alliance to End Homelessness to try to provide a forum for exactly that kind of exchange. And we did have some exchanges on COVID practices. Vaccination, we got Quebec was one of the early ones to get vaccination, but it's because we were one of the early ones to get slammed by COVID. When you look back, it was inevitable. It had to happen. It had to happen. I look back and because anyway, it was like we were fooling ourselves to think it was not gonna, like we had figured it out. It just, as I say, it took like 4 or 5 cases up in this shelter. Those guys come down to our shelter, and then we don't test. They go around like they're mobile, right? They're going to go down. They're going to go down to what's called the Grand Quai for lunch. And they're talk like you can have your distancing and forget it, like all of it, like this is congregate living and congregate lifestyles, and COVID, like it's going to happen. And so it did happen, and it happened big time. I don't think we could have done much more than we actually did, to be honest. I mean, what worked really well was hotels, and there was some great studies out of Toronto on this. That and we did it here in Montreal, and I think that was another one of those protective forces. Like we threw up the big Hotel Place du Puy, and you got your own room. You can close your own room. So not only are you protected from winter, because this happened through the winter period, you're protected from COVID. The numbers of people who got it at the hotel versus the numbers in the actual shelters was way lower. So I mean that's obvious, right? In a way, they had a place to close the door and lock the door. So so. That's why the hotel is still open to this day. Normally speaking, it would have closed March 31st, but they're extending it. And you watch, they'll extend it again. That's 400 extra beds they made available in the hotel for that strictly that protective purpose. Now, from a if you will, from a psychosocial point of view, it's terrible because those people, it's like old shelter days. Like you go into the hotel, you get 12 hours in there, and then you're kicked out in the morning because that's the budget that the city of Montreal offered. So they're wandering out, still exposed, still dangerous, and getting no support to try to find housing, if you could find housing, which is the other issue we were talking about before. Anyway, it's a very tough area. It's a very, very tough social area, and it's not getting any better. This is kind of, if I'm talking personally just for a second, this is, I'm in the business of reducing homelessness. I want to see the number go down. And right now, man, it's going the other way.
Interesting. I've got two more questions pinging in here. Rim, do you want to go first? And then Ricardo, you can ask yours.
Sure. Hi, thank you so much for speaking with us. It's really interesting. You've talked about the rapid changes that kind of took place during the pandemic and adapting quickly to public health measure. I'm interested if the pandemic had any effect in how you approach your approach in reducing homelessness, and if you can speak a bit about the opportunities and some of the challenges post-COVID, especially you're talking that this is not over, and there's also an indicating research that homelessness was continue to grow. So I'm interested in kind of the opportunities and challenges post-COVID.
Yeah. Oh, I can't wait to talk post. I mean, I talk post-COVID there. Like we can't wait for it to be. There's no sector that wants this to end more than ours. There's nobody, I think, in Montreal that wants this to end more than me. I got COVID too, by the way. I had a mild case of it, and it's funny. I worked. I got called on Christmas Day. Mr. Hughes, you got COVID. So it can hit anybody. It's funny, there was how it got in, we don't know. As I said before, we don't know. We got questioned in the media because it started in one of the Indigenous shelters up the Open Door, as I say, above Sherbrooke Street. And we got really tempted, with the media was tempting, was there something about Indigenous home? There's not. There's nothing different about it. And it could have gone in anyway. And I don't know if we could have done much more. In terms of our training, our protocols, we work like this with public health. We share information very, very quickly with other shelters when there's cases. I'm really proud of what we've been able to do. As I say, Old Brewery manages the isolation facility, so we know the numbers, the minimum numbers anyway. And it's been magic how we've worked with the sector to try to protect both people who are isolating and others from the virus. Now, there's some suggestion that COVID has been one of the reasons that homelessness is increasing in Montreal. It's not clear. It's not clear the connection between COVID and increasing numbers of homelessness. There's been some suggestion that there's been early release of people in correctional services because of COVID, because of the dangers. And so those who were on the borderline for release would have been given an accelerated release, and many of them had nowhere to go, so they came into the sector. But I've seen nothing to suggest necessarily the connection between the two. Our big, the fact that we have so little place to refer people, there's so little provincial subsidies for rent supplements and so on to help people afford a housing market that's out of control is a really big factor. People setting up the tent cities, I think, are a demonstration of that massive frustration. That's not the only demonstration of it. It's one of them. So, I mean, I got to tell you, I'm not post-COVID yet. I'm not even like, what can we do post-COVID? I mean, there's so much we want to do on data and research. There's so much we want to do on training, super specialized services, housing for highly complex men and women who are in our sector. We want to really lower the microscope on the prevention side of things and start to work with institutions on how they can take on the mandate of assessing and referring or diverting I think that's really, really fertile ground for the future. We want to be part of that. But I tell you, I feel literally handcuffed from doing that. Our staff is just so focused on just trying to get through the day and protect these folks to the extent possible. Because it's real danger, right? I mean, if you get a bad case of this, you can die. And we had one death here. It was actually not strictly COVID related, but it was COVID related and curfew. And I don't know if you remember the story of the Indigenous man who died in the porta potty, but it brutal for the whole sector. I won't get into it, but it's still palpable.
We've got James. You're good to stick around for another 5 or 6 minutes till 4 o'clock with us. Ricardo, you've got a really interesting question. Do you want to fire away?
Yeah, well, it's actually exactly related to your last comment, right? Like we're seeing all the stay-at-home orders, or in this case, the curfew, which with very little leniency have done some material harm to homeless communities in Ontario and in Montreal. I know that a little while after that incident, the incident that you just talked about, some changes were made so the police would stop intervening with the homeless population in particular. I wonder if OBM and other organizations like this had any role in advocating for these changes, and if they didn't, what would you have said to the government?
Well, I was probably interviewed 20 times on that issue. You know, what's the impact of the curfew on homelessness? And my answer was always the same. Homelessness doesn't stop at 8 o'clock at night. Like, what are you thinking? I mean, in fact, the provincial government funds us to provide 24/7 services. So the fact that we're putting curfew on these folks, they can't, many of them live on the street. What, you're gonna find them? Because they're walking around? Our guys who leave the shelter to go for a smoke or go see people across their friends across, like what, we're gonna stop doing, like what? People who have to go, they wanna go outside to inject because they can't inject in our building. We don't allow that. So it's kind of like all those facts, and I was like one of many people saying that. I mean, that was the kind of the media foundation for the buildup, and then there was a lawsuit that was taken to find that the measure as it affected homeless people was a violation of charter rights to mobility. I'm not sure what the other grounds were, but they won, and an injunction was successfully brought against the government. They didn't appeal it, so the curfew no longer applied. But I would say it didn't much matter anyway, because on the ground, the police weren't ticketing homeless people. They were using good judgment. We were told there was only 6 tickets in Montreal that were given out, 3 of which were reversed. So, as I say, you know, with the kind of numbers that I've told you about, it could have been way worse, but the police have come a long way. Talk about another vector of the work. They've come a long way since say even 5 or 6 years ago in terms of the way they view and treat homeless people.
Interesting.
Did I see something from Pearl on the line there?
Yeah. Pearl?
Yeah, it was just to follow up on what Jim was saying. Nice to see you, Jim. That the court decision that Jim just referred to actually wasn't on mobility rights grounds, because in the charter, mobility only applies to interprovincial mobility. But what the court essentially said was it's impossible for these people to comply. They have no homes to go to. So the application of the curfew, which is an order in council and a ministerial directive, was just struck down and declared inoperable as against homeless people. So that's the way the court decided it. They didn't even need to go into the charter grounds. It was essentially a long way of saying that the application of the order was ridiculous.
Nice.
Interesting. Does anyone want to get a last question in before we wrap things up? Clarissa has a question. Clarissa, do you want to ask it yourself, or do you want me to ask it? Clarissa? Oh, okay. She wants me to ask you. James, she wanted to know, this is Clarissa, she wanted to know if there's any special issues surrounding homeless, indigenous homeless in the pandemic or in general. Are there any specific or more particular issues or concerns or policies surrounding the indigenous over the course of the pandemic?
No, I would say not. I mean, I would say the organizations like Projet Autochtone du Québec, who are specialists in this area, would say that I think they got the kind of support they needed at the right time. They had to, the Open Door had to close their facilities. The PAC had to reduce the PAQ, the Projet, they had to, but so did so many other shelters as well. A significant number of their clients have problems of chronic alcoholism, chronic consumption. And so that's why we were very pleased to partner with them on the isolation facility at the Royal Vic, so that those homeless people with Indigenous heritage who were also experiencing chronic alcoholism could be supported in a culturally appropriate way. And it was our first time to work that closely with the PAC teams, and it was such a learning experience for us and really wonderful. And we want to do more of that with them in the future. But overall, but that's also true of many non-Indigenous people, right? But we needed to make sure we had that capacity at the only isolation facility in the city, which is what the Old Brewery was managing. So anyway, it was in the end, as I say, I think it's worked out really, really well. And I would say no, that there has not been any particularly different impact of COVID on the Indigenous homeless community as any other.
Okay. I think that wraps things up. I want to thank you very much for your time.